Good morning, this is Mrs. B again. The lesson we're going to have today is going to be range of motion exercises. I've had each of you in anatomy class and we have covered the skeletal system and the muscular system, the joints, articulation. You know that there's connective tissue, tendons, and ligaments. Now, when we speak of range of motion, we're actually talking about keeping the mobility in our joints and making sure that we don't have any frozen joints from not using them, that we don't have any atrophy of the muscles that are attached to the bones, and that we keep a good range of motion so that a patient can stay flexible, can stay optimally fit as much as they can during a time or a period of illness. Some diseases, such as multiple sclerosis, actually affect how well the muscles work, and you can actually have disuse syndrome. You can also have arthritis or joint changes, degenerative joint disease, that prevent having nice flexible range of motion in the body. And of course, you can also have a great deal of pain associated with this as well. So as we get into range of motion exercises, I have attached at the end of this just little mini PowerPoint the Nurse Aid skills video showing you how to do the range of motion in the shoulder and in the leg, because that's just something that they test on for Nurse Aid to make sure that you're able to do exercises with your patient and identify certain things. This slide, there's a bunch of points that you need to remember when you are going to be performing any type of range of motion or any type of exercises, is that you are going to wash your hands, of course, that you're going to knock, you're going to verify that it is the right patient, and you will explain to them exactly what you're going to be doing. If someone is just going to be a yes, yes ma'am, yes sir kind of patient because they just figure they're a patient in the hospital, they just need to do what is being told to them, that's not really true. They have the right as a patient, whether it's long-term care, acute care, outpatient, or just a longer hospital stay, to know exactly what's going on and to know what is involved and what it is that you're going to be doing to them. You need to be able to emphasize the importance of them following through with the treatment that is prescribed, and make sure that you provide for privacy, because when you work on a patient's limbs, you could expose parts that you have to worry about the dignity and the modesty of your patient. Always using safety measures. If you are going to be doing exercises where the patient is actually going to be participating, you need to make sure that the bed is at a safe height and that the wheels of the bed are locked and that they have proper fitting shoes on. You yourself must actually practice proper body mechanics, because you don't want to injure yourself trying to lift, push, or move a patient. And frequently ensure the comfort of your patient. If your patient, say, had a total knee replacement, okay? Let's say he had a total knee replacement on the right knee. He's gonna have, or she's gonna have, quite a big incision line. You know that when they put the prosthetic into the knee, there's a great deal of hammering and sawing and screwing that actually they use glue as well, that is going to have happened. They would be cutting through the skin all the way down to the bone, and that could have a great deal of pain. Yes, they need to perform the range of motion. They need to keep that new joint working properly. However, okay, we have to make sure that we are providing for their comfort, because if they are free of pain, they're going to cooperate and your session is going to actually go well. So when I'm talking about making sure your patient is free of pain, perhaps a half hour to an hour before they would be scheduled to have, say, a physical therapy session or an occupational therapy session, or if you as a caregiver were going to be providing range of motion exercises to them, restorative nursing practices to them, just to make sure that maybe even just the nurse gives them Tylenol. If you are the nurse, have them ready for physical therapy and give them pain medication so that they have a more pleasurable experience. And again, just with anything, if it hurts as you are performing the range of motion or the exercises, you don't want your patient to be in pain and you don't want them to be suffering. So you want to make sure that you report it and that you were only allowed to do whatever exercises or how much or how limited it was, so that perhaps there could be a change in either medication or the exercise itself. Perhaps they would need to be reevaluated by the physical therapist to see if a different, lesser routine could be ordered and they could graduate up from there and be able to participate further. The types of range of motion. I'm just going to be going over 4 types of range of motion because this is very, very important. It's important on how much participation you actually will be getting from your patient. So the first type is passive RM, passive range of motion. The caregiver provides the full assistance for the exercises. Just like in the nurse aid video, you are performing the exercises, you are actually moving the extremity and the joint. The second type, active assistive range of motion. The patient participates, but they do require you, the caregiver, to assist them in the exercises. If they're providing active assistive range of motion, maybe as that patient gains strength, they will be able to participate on a higher level and be able to actually take part in the exercises a bit more. Now, active range of motion, the patient is performing the exercises on their own and following a program from the physical therapist. The physical therapist or the PTA, the physical therapy assistant, will actually be supervising these exercises, evaluating how well and effective the patient is able to perform them, okay? And they actually will change exercises once a goal is met that the patient, he actually performs these with great ease. Now the last is self-assisted range of motion. The patient is taught to use the stronger extremity to move the weaker extremity. An example of that would be if someone had a CVA, which you know is a cerebrovascular accident or a blood clot in the brain causing a stroke, and they have a deficit in the ability to move one side. So let's say that we have left-sided weakness, so obviously there is a CVA on the right side of the brain, because you know that if it's the right side of the brain, the left side of the body is affected. If it is the opposite, then it's the opposite, okay? So he had a right-sided CVA, he's gonna have left-sided weakness. He would use his stronger right side, his right arm, to be able to actually move his left arm, which would be the weaker extremity, okay? There's all different types of range of motion. The pictures over here, this one in the right corner is actually displaying self-assisted range of motion. And this picture over here actually could be active assistive range of motion or passive range of motion, okay? We don't really know how much strength this caregiver is actually providing. On the next slide, I do want you to watch these videos. These are actually really good videos. I was pretty picky with what I put on here. I'm not going to show them to you. You can watch them at your leisure. The first one is demonstrating upper and lower and includes multiple exercises, all different types. The second video is the caregiver is explaining the exercises very well. Although similar to the previous one, it is more detailed, more in depth. And the last video will be talking, the therapist explains the 4 different types of range of motion and how much assistance is actually needed to perform them. As a caregiver, if you got a job, say at one of the hospital networks, Lehigh Valley, St. Luke's, inpatient, outpatient, home care, you may be needing to provide therapy or range of motion or any type of a physical therapy or restorative type program at home, and you need to be familiar with how to perform them. Here at the school, we are going to be practicing range of motion, upper and lower. so that you can actually do the range of motion to get some good practice in. But this is actually a very good skill to know, and you'll probably be using it for the remainder of your years, no matter what it is that you decide to pursue in healthcare. So this is going to be the end of our video today. Please watch the YouTubes and feel free to review this again and again as needed. Thank you.